Hi everyone, my name is Maggie Brown. I'm a postpartum nurse at West Penn Hospital. Early this morning, the U.S. House of Representatives voted to pass the largest Medicaid cut in history, stripping more than $625 billion from our most vulnerable patients and community members. These cuts would slash funding for our hospitals and devastate our patients, especially pregnant patients and newborns. I'm here today to express how deeply disappointed and outraged we are to see these cuts advancing through Congress. We must demand that our senators act now to stand up for Medicaid and quality health care for all, because the U.S. Senate can still vote to protect patients by blocking these cuts from going into effect. Now is the time for Pennsylvanians to contact their senators and let them know that any Medicaid cuts are absolutely unacceptable. At West Penn Hospital, we welcome thousands of babies into the world every year as one of the largest birthing centers in the region. Hospitals from across the tri-state area send critically ill infants to our Level 3 neonatal intensive care unit. What people may not know is that 1 in 3 live births in Pennsylvania are covered by Medicaid, and that number is even higher for our NICU babies. 42% of Pennsylvanians on Medicaid are children, and many of the adults on Medicaid are new parents struggling to make ends meet. Without Medicaid, vulnerable, recovering mothers would leave our hospital knowing they carry debt that can follow them for the rest of their life. Without Medicaid, mothers might not seek prenatal care. We might miss issues that are developing and instead discover those complications at delivery or a few days into life. Without Medicaid, patients may not go to their OB when they're experiencing symptoms of preeclampsia or preterm labor. These can be issues of life and death. And let me be clear, cuts would impact patients that aren't on Medicaid too. Because a substantial portion of our hospital's funding comes from Medicaid, insurance and hospital executives will make sure the cuts land on the backs of us and our patients. Executives will try to cut our funding, our staffing, supplies, and benefits, which will cause more workforce shortages and turnover. And it gets worse. When patients don't seek preventative care because they cannot afford it, they receive emergency care. That means our hospitals end up caring for more acute patients and visitors face longer wait times while budgets shrink. So why is it that politicians are planning to cut Medicaid, even though we live in the richest country in the world? Why is it that billionaires need another tax break and health insurance executives need even more power over us and our patients? Why is it that elected leaders are not instead working to expand healthcare coverage to everyone, like so many other countries have achieved? The answer is simple. They don't think we're paying attention. They think nurses won't sound the alarm. They think patients won't stand up. They think that decisions about us can be made without us. That's why we're here. As nurses, we cannot let this moment pass without making sure our patients and our communities know what these cuts would mean for them and our hospitals. I'm asking nurses and community members to participate in the National Call-In Day today. Call your senators today to demand they stand up for Medicaid and quality health care for all. You can call Senator Dave McCormick at 202-224-6324. You can also call Senator John Fetterman at 202-224-4254. You can also go to PAMedicaid911.org to find more ways to take action. We need to tell the Senate to stand up for Medicaid and healthcare and quality healthcare for all Pennsylvanians. When we all unite and stand together, we can protect and expand healthcare funding. Speaking next in support of Medicaid is State Representative Dan Frankel, Chair of the House Health Committee. Thank you for coming today.
Thank you. As introduced, I am Representative Dan Frankel, and I'm proud to represent a district where nurses fight like hell for their patients, and where working people don't take injustice lying down. Let me tell you what's happening in Washington right now and what happened last night. Republicans are gutting Medicaid, not because they need to, not because the money's not there, but because they want to hand out even more tax breaks to billionaires and mega corporations. Let me be clear. This is a war on working families, on seniors, on veterans, on parents with newborns, on kids with disabilities, on caregivers, on nurses, on every person in our community who depends on Medicaid to live with dignity. And yes, these Republicans are willing to harm the people in their own districts, their own neighbors, their own constituents, just to keep their campaign donors fat and happy. It's disgraceful. It's cruel and it's cowardly. You want numbers? Let's talk about numbers. 1 in 3 births in Pennsylvania are covered by Medicaid. 1 in 2 kids. 2 in 5 people with disabilities. 1 in 10 veterans. You cut Medicaid and you're not trimming fat, you're cutting through the heart of our communities. And what happens when people lose their coverage? They don't disappear. They show up in emergency rooms sicker, later and more expensive to treat, and they die of preventable diseases. They lose their jobs and fall into poverty, and the cost, the financial and human cost, skyrockets for everyone. Medicaid cuts don't just hurt the poor, they undermine our entire healthcare system. Let's stop pretending this is about balancing the budget. This is about priorities. And today we see plain as day the Republican priority is billionaires over babies, hedge funds over hospitals, greed over human lives. We are not going to let them get away with it. We stand with our nurses, our caregivers, and our patients. And we raise our voices early and often. Put this number in your phones, 866-426-2631. Call Congress, flood their phones. Tell them we will not trade human lives for billionaire tax cuts. Not now, not ever. And to Republican lawmakers in DC, if you think we'll stay quiet while you burn down our safety net to fund yachts and stock buybacks, you've got another thing coming. This is Pittsburgh. We take care of the vulnerable. We take care of our caregivers. We believe in dignity and decency and in health care for everyone, not just the privileged few. And together, we're going to fight like hell to protect Medicaid and build a future where care comes first. Thank you very much. I'm not sure who's our next speaker.
Hi, everyone. My name is Natalia Rodriguez, and I work on a cardiac step-down unit at Allegheny General Hospital. Medicaid is very close to my heart, both professionally and personally. As a nurse, I believe passionately that all of my patients deserve the highest quality of care without having to worry about going into debt or sacrificing their plans for the future. So many of my patients and their children depend on Medicaid to keep them healthy. Unfortunately, there are politicians that want to cut Medicaid, and they want us to believe that our patients don't deserve health care coverage. But who are they to decide who does and who does not receive the life-saving care that my colleagues and I provide? Who are they to decide who lives and who dies? When a patient comes to my unit, I don't ask them who they voted for. I care for them no matter what, because that's our calling as nurses. And I believe that all of my patients deserve the care that they receive, and I know that my coworkers would agree. And that's why I'm here today. It's time to remind the elected leaders that it's voters that put them there, and it's voters that can kick them out. I'm asking everyone in Pittsburgh to participate in the National Call-In Day today by contacting your senators and asking them to stand up for Medicaid. This is personal to me. Before I became a nurse, I was covered by Medicaid when I gave birth to my son at West Penn. My sister gave birth to my nieces and to my nephews at West Penn. West Penn is important to me, and I worry about the impact that Medicaid cuts will have on hospitals like West Penn that focus on labor and delivery and postpartum care. As a patient, Medicaid paid for my lupus diagnosis and for my medications. And without Medicaid, the cost of healthcare would have completely put me under. I would never have been able to climb out of that hole. Because Medicaid is low cost, and accessible for working people, I was able to save the money that I needed to go to nursing school and give my son the life that he deserves and the opportunities that he deserves. Medicaid is the reason why I'm here today. How can I allow the ladder to be kicked out from underneath other moms and babies? How can anybody? And I can't, in good conscience, sit here and sit this out while I see politicians cutting Medicaid to give huge tax breaks to the wealthy. Let's talk to everyone we know and ask them to call Senator Fetterman and McCormick today. Thank you. Speaking last is Aaron Gabriel from Pennsylvania Health Access Network.
Thanks, Natalia, and thank you to the SEIU and to everyone for being here today. This is a really important issue. I know we know what happened in the House early this morning, and the fight moves on to the Senate. So my name is Erin Gabriel. I'm the Government Affairs Representative for the Pennsylvania Health Access Network. We're a statewide organization focused on making sure everyone in Pennsylvania has access to high quality, affordable health care. I'm also the mom to 3 amazing kids who happen to have disabilities and rely on Medicaid. Here in Pennsylvania, we are bracing for what these drastic cuts will mean for our already struggling healthcare system. I think you've been hearing a lot today about the numbers. 3.1 million people in Pennsylvania are covered by Medicaid right now. About 40% of all births in Pennsylvania are covered by Medicaid. Over 500,000 Pennsylvanians will lose their health coverage under this current proposal. $2.3 billion or likely more will be cut out of our state budget, ultimately impacting everything from schools to roads and bridges, and that's annually. That giant hole in our budget and the proposed changes to how the state can assist struggling hospitals, combined with a surge of over $600 million in uncompensated care resulting from all those folks losing coverage, is going to decimate our hospitals, especially those in rural areas. And despite the promises being made by some in Washington that these cuts will not target our most vulnerable populations, those are the programs that will be most at risk. Programs for children like mine with disabilities and adults with disabilities, and our seniors who rely on home care, assisted care, hospice care. Those are the programs that will be first on the chopping blocks. They'll have to do that to make up the shortfall. Behind all that math are real people like my own kids who rely on Medicaid to access services they need not to just survive, but to thrive. But also people like my mother who's living with Alzheimer's, to make sure that my daughter, who uses a wheelchair and has a lot of disabilities, has access to the therapies, medical supplies, and the help that she needs to live at home with us instead of being relegated to a nursing home as a teenager. My mother, who lives with Alzheimer's, accesses many of these same services, all paid for through Medicaid. But despite the promises from some in Washington, with cuts that are counted in the billions of dollars, there simply is no way for these services to not be impacted. Seniors, children, and adults with disabilities will all be put at risk. People will die. But this bill doesn't just put kids like Abby at risk. It puts all of us at risk. Medicaid is important to the financial stability of most hospitals, but for some hospitals, it is a lifeline. These hospitals are often in communities with a larger number of Medicaid patients, and they rely on Medicaid payments as a core line of their business. Additionally, many of these hospitals are already struggling financially. When hospitals close, communities struggle. Not only do patients lose access to hospital-based care, but also other healthcare services and to their trusted doctors. Healthcare jobs are at loss, and our local communities and small businesses struggle. Changes to Medicaid funding would force states to reduce or limit payments to these hospitals, worsening their already existing financial vulnerability. Additionally, changes to Medicaid eligibility or enrollment that result in more uninsured patients result in the strain of an increased level of uncompensated care. So between the changes to the ACA, to the penny and healthcare enrollment marketplace, And to Medicaid, we're looking at close to 600,000 newly uninsured Pennsylvanians, resulting in $707 million in uncompensated care in Pennsylvania next year. These combined pressures would likely force many of these hospitals to consider shuttering core services like labor and delivery, or even closing altogether. These closures have a devastating impact on local communities, patients, workers, small businesses, and employers. And over the past 25 years, Pennsylvania has already seen 78 closures or reductions in core services, 26 of those in rural counties. And at FAN, we've identified 47 more hospitals in Pennsylvania that are at risk of closure across the state right now. We add these cuts to that, and we're in a crisis. Medicaid is healthcare, but it is more. Medicaid means families can stay together. It means people with disabilities can participate in their communities and live their lives, just like every other American. And any cuts to Medicaid threaten not just my daughter's future, but everyone's. And we cannot let that happen. Thank you.
Okay, so that actually concludes that part of today. So